My name's Alan Donnelly, and I'm here on behalf of the Physical Activity for Health Research Cluster, which is part of our university's Health Research Institute. And I'm going to tell you a little bit about PhDs in that research field. So what you see there is the names of all the academics in the research cluster, and all of them have PhD students. We have, I think, at the moment in the high 20s, I think 28 PhD students currently between the group. That's really the team. We all work, although it's all physical activity for health, we all have different aspects that we work on. So I'll go through the different areas and you'll find that some of us collaborate. So sometimes we work in teams, sometimes people work individually. But there's a great breadth to the type of project that can be undertaken in the physical activity for health field. I have to say as well, our research area is the University of Limerick's highest ranked research area in the university rankings. It ranks 50 to 100 in the world, which is pretty solid, and that's in the QS rankings. So we have quite a strong international reputation and a lot of very strong international collaborations. We've got four focus areas really. One is measurement and surveillance and determinants of physical activity. So that means measuring how much physical activity people do, populations do, doing surveillance to see if it changes, and looking to see what factors in people's lives affect their physical activity. For instance, if you have small children, that might affect your ability to do physical activity, or if you live in a deprived area, it might affect your facilities access. So many factors determine whether you do physical activity. Very interested in the kind of biomedicine of physical activity, the effects of exercise, how the mechanistic systems that determine how physical activity impacts on health. And you probably know that it impacts upon your risk of getting cancer, your risk of getting cardiovascular disease, strokes, type 2 diabetes, and a list of other conditions. And then physical activity and exercise as medicine. And that means that if you do have a clinical condition, for instance, multiple sclerosis, there's very strong evidence that if you're active whilst you have the condition, it will improve your survival chances, it will improve how you cope with the disease. And if you need to have surgery, etc., you will deal with it better if you're more active, even though you have a clinical condition. And then we're interested in how that impacts policy. What government policies should there be to increase and change physical activity levels across sectors like public health, community healthcare, sport, schools, children, adults, older adults, etc. So I'll start going through areas. So this is, we'll just go back there. This is from Matt Herring, and Matt's a very strong researcher in the area of physical activity in exercise and anxiety depression. And Matt's got an excellent team and he's getting some fantastic publications in the area. And this kind of slide, a lot to take in now, but you can screenshot it, looks at the different areas he works on. It's essentially, we know that people who are more active have lower levels of anxiety and less likely to suffer from depression. And it can also be used as a treatment for people who do have those conditions. So it's a very exciting area of work. Matt put in some examples of people who are working with him or have recently worked with him. Killian is now postdocing as Brett. They've both completed. Carl's working at the moment, so is Chloe, and they're doing kind of excellent work in those areas, as you can see there. So a nice research team and a developing research team. Also, since Matt had done that, I wanted to put in, you might wonder, what do people do with a PhD in this area? So I'll give you some examples of PhD graduates. I could have put, I think we've north of 50 in total, but I wanted just to put in ones quickly to show what they do. So Cormac graduated a couple of years back. He's Associate Head of Performance Services with Swim Ireland. He's working with the Irish swim team, leading towards what should have been this year's Olympics, will probably be next year. Kieran Dowd's a lecturer at AIT. Deirdre Harrington is a senior lecturer at University of Leicester in England. Laura Comer is working with HIQA in the HSE. Joe Costello is a senior lecturer in Portsmouth in England. And Blaughan Casey has come back. She postdoc for a while and she's working for our research cluster as project manager. And I could show you an awful lot more stories of success of graduates with PhDs in our field from our team. So moving on, this is something about biomedicine of the area. And it's Dr. Brian Carson's work. And he's very interested in how does exercise actually change your risk of getting disease. And one thing he's very interested in is the human secretome. And that means that the muscle gives off chemical factors that travel in the blood and have body-wide effects. And an example of that is that we know, for instance, that exercise affects neurotrophic factor, which is a factor that encourages neuronal growth and is very important for improving brain growth, improving things like memory. And that's very important for instance, people who are maybe at risk of developing Alzheimer's, but also for children and adults who want to study. That exercise may actually improve your memory retention, etc. But there's a lot more to it than that. And Brian isn't actually working on that example I gave. He is working on other signaling that may be important in the risk of developing cancer. So it's really important and exciting work. So exercise in clinical populations is a big focus of ours. We have many of our researchers work on it, including myself and Catherine, Roisin, Blaughan, and Professor Susan Coates and Matt Herring. So large numbers of our work in different clinical populations, including people with cystic fibrosis, people with multiple sclerosis, and people undergoing cardiac rehabilitation. And we do a lot of kind of physical activity intervention work in people with MS. We're one of the top ranked sites in the world for this type of research. Professor Coates has built a really strong team and has done some excellent work. And we really are one of the top places for this research. And it's also benefited the MS Society in Ireland and people with MS in Ireland. And there's now a lot more options for them to undertake physical activity. And Susan and her team has been able to show that it's very beneficial. And UL Medex, Professor Catherine Woods runs this, and it's a program for people with existing clinical conditions. So perhaps cardiovascular, type 2 diabetes, people living with cancer or recovering from cancer. And we get them into UL, obviously pre-COVID-19. We're doing some remote work at the moment. But when COVID-19 is hopefully resolved, we'll be bringing people back into the UL arena and running training sessions with them. And it's very important for the management of their disease. And we run a lot of different programs, and we try and track the people on the programs and do research around how it's helping them manage their specific disease. So cystic fibrosis, and apologies, the slides got a little bit messed up in the translation there, but cystic CF is very high levels in Ireland. As you may know, Ireland's got the highest rates of CF in the world, and physical activity is good for people with CF. There are some constraints there. For instance, even pre-COVID, people with CF would not have been able to exercise together because they're all at quite high risk of upper respiratory tract infection, and you don't want them to transmit one to the other. But we know that people with CF benefit greatly from doing physical activity, improves the muscles that drive respiration, and it's of great benefit to them. And then and this is more looking at Catherine Wood's work and my own work and Matt Herring's work, that surveillance of physical activity levels across children and adolescents. We know that children in Ireland and across the whole of Europe are much less active than they might have been in the past. and that is storing up long-term issues. Probably doesn't have a major effect on the kids now unless they get obese, but it will store up a risk that means that when they reach middle age, they'll be at much higher risk of diseases of inactivity like cardiovascular disease. And we do a lot of work with the WHO, and we're linked into a large number of European and national bodies for that work. And one example of that is the Active School Flag project that Professor Woods is running, that's working with schools and testing in schools. And iPark is a national collaboration of physical activity researchers, so brings in people from lots of different institutions across Ireland, north and south, in order to examine and have a kind of strategy around physical activity research. And so there was a bit of a thing there. The Policy Evaluation Network is a European project that Catherine Woods, myself and Kieran McDonagh are all involved in, and that is setting European policy for diet and physical activity. Really exciting project. Professor Woods is one of the co-leads of the project, so we have a real big influence in Europe on this project. Very exciting. There's some really nice work going on around that. So my own work and some of my colleagues, so Brian Carson also collaborates, Matt Herring collaborates, as you can see in the paper there, is the effects of sedentary time and sedentary behavior. And now all of us are working from home. I suspect there's a lot more sedentary behavior going on. We're sitting, or maybe not sitting in front of the TV with a can of beer, but we're sitting in front of our Zoom and Teams calls, and possibly being even less active than we might have been before. And sedentary behavior is recognized as being a risk factor in its own right. And the kind of work we do, there's a lot of publications from my research team. We use device-based measurements. So we put measurement devices that tell when the person is sitting, tell when they're active. We've done a lot of work around calibrating the projects. There's two of my PhD students working on calibration of devices, and we use the devices in all kinds of populations across Ireland. One of the more recent ones was the Mitchelstown cohort rescreen, a national level project run out of UCC, done in the small town of Mitchelstown, County Cork, but looking at older adults and their risk of getting long-term health problems. And that's been really exciting work, and Cormac Powell was the PhD student there. And we can tell from our devices how much time people spend across the day, sleeping, standing, doing physical activity. And I think the interesting thing here is that people are sedentary almost as much as they sleep, and look at how little physical activity, particularly the more beneficial moderate to vigorous physical activity people do in the 24-hour cycle. And that's worrying for Ireland as a population, that people can be quite inactive, and that was before COVID-19. The other big exciting project, just to finish off, that we're working on right now is Go Green Roots. Dr. Tig McIntyre is PI on that. I'm also working on it, as are many of my colleagues. And it's a 10.5 million euro grant to look at green intervention across Europe. And one of the target cities within this is Limerick City. As you can see, we're also working in Bulgaria, Finland, Estonia, Sweden, and France. The project kicks off next month, and we're hiring PhD students at the moment for it. Unfortunately, that has just closed, but there may be other opportunities in the project as time goes on. And that's an opportunity to work with a massive team across Europe, looking to see whether green interventions affect things like active travel, they affect activity levels in retired people. Are there restorative spaces? If you go and sit in green areas, does it improve your mental health, your cognitive function, etc.? So it's a real exciting project. And that's it. So if we have any, might just escape from this mode where I can see questions, and hopefully let me just end the thing there. Oh, I'm trying to end the presentation. Oh yeah, there we go. Yeah, so it's a presentation end. So I don't know if, I think it's only yourself, Patricia, but if you have anything to ask, feel welcome. Otherwise, enjoyed the show, and that's basically it for now. I'll wait a couple of minutes in case you have anything to ask there. And you can use the chat. Can I turn you on? I can turn your mic on. Okay. I'll just look in chat there and see if there is anything. Okay, nothing there. Okay, yeah, no problem. Well, thanks, Patricia. So I think that's it. So, Ger.
Oh, yeah, and yeah, no, I just had a question, Alan. Is that okay?
Yeah, of course.
Yeah, no, because I found that absolutely fascinating, and it was a great presentation, really excellent. I think I agree with what Patricia said. It was a really informative overview of the fantastic research taking place in the department, and there were so many things which I found really interesting. One of them was for activities for people with multiple sclerosis, for people with MS, with multiple sclerosis, and just about the kinds of exercise that people can do. Is it very much dependent on the degree or the age of the participants, the degree of or the severity of the illness, or is it very much dependent on?
It is, Jerry, yeah, because some people with MS, you wouldn't really know they had MS. They might have
I know.
and then they have minor kind of disability, but unfortunately, other people with MS get very severe MS, and then people get bouts of it where they're worse. So I think Susan's work is very much about tailoring it to the person and doing what's achievable for the person. And one of the big problems with MS that people don't realize is it actually affects your sympathetic nervous system, and it makes exercise feel much harder than it is. So someone with MS doing even light exercise might feel like they're running up a mountain. It really affects their perception of exercise. And that puts a lot of people with MS off doing anything. So that's a big kind of barrier to overcome. And a lot of the work is working with people with MS, trying to get them over that barrier and trying to get them to be active. And there's a lot of things like trying to improve balance, doing a lot of kind of balance work, balance boards, those things, but also trying to maintain muscular strength. And most people with MS don't die of MS. It's only the severe type of MS that is the real bad one. Something like 95% of people with MS live with MS, and like the rest of us, die of the common diseases like cardiovascular disease and cancer. So they have the same kind of risk factors as everyone else, but they get worse if they become inactive. So it's encouraging them to maintain activity is really important for people with MS.
Wow, no, that's fascinating, pretty mind-blowing. And just to follow up with that, if somebody's in the early stages of MS, I was just wondering, for somebody like that, would it be, if somebody who was recently diagnosed, would even that kind of exercise be a strain, or is it something that really exacerbates with the condition?
And unfortunately, I think if she's only had one or two bouts of it, she might not be too affected and might only have some peripheral neuropathy. But as it progresses, exercise does become harder for two reasons. One is the balance issue, and people worry about doing it because of risk of falls. And that's exacerbated as you get older because you're worried that the fall might result in like a hip fracture or something more serious. And the second is this kind of barrier that as MS progresses, it affects your perception of intensity. And even light exercise can feel really hard. If she's able to exercise safely, the more she does, the better, within reason. There is an issue about over-exercising, and people talk about this with COVID-19 as well, that people with conditions like that, even if they're able, they probably shouldn't try and say run a marathon or do anything extreme, because when you do those kind of extreme things, your immune system is temporarily decreased. Now, in MS, that may be no bad thing, but in general, it's probably not a good idea because people with MS and everyone are susceptible to secondary infections. And of course, COVID-19 is around. You'd probably want to go a middle line of a good mix of strength, kind of balance, endurance, cardiovascular fitness, but nothing too extreme. And some people feel that they should do those kind of big challenges, swim the channel or do something extreme like that. And possibly, not on every case, you'd have to look case by case. Possibly it's not such a good idea to go extreme, but definitely doing moderate levels of exercise, even fairly high if you build up to it gradually, is definitely good.
Excellent. Yeah, fantastic.
No, I just wanted to build on that. What about CF patients, Alan? To me, I suppose I've always had the perception that they're a very vulnerable patient group because they're so susceptible to infection. So what types of moderate exercise, what would you recommend?
When they're young and not affected, possibly any normal exercise a kid would do is fine. The big problem is groups. Their big risk is upper respiratory tract infections, so coughs and flus that we might shrug off become really serious for them. And a lot of kind of group-based activity might present a risk. Now, right now with COVID, that's fine, that's happening. Back when things are normal. And one of the things you do in exercise in clinical populations is you bring them all together, and so they can talk about the condition. And there's the one group that you can't do that with, because unfortunately they tend to be vectors. So a lot of them tend to be nursing some kind of our upper respiratory tract infection, and they can cross-infect each other. So you'd encourage them to exercise, probably not exercise in crowds, not be in places that present a risk of upper respiratory tract infection. But other than that, for younger people, I used to swim with a girl with CF, and she was a great swimmer. So I don't think anything's completely ruled out. I do think as they get older and CF becomes more of a burden, it's problematic. But certainly things that help with the breathing. So cardiovascular exercise, endurance exercise that helps your breathing muscles is possibly the best type for them.
Thanks, Alan.
Just if I could come back in, just one other question I had, Alan, and there are just so many. It was really excellent to get the whole overview of so many things going on, from iPark to Go Green Routes to the work that Matt Herring is doing, on anxiety and depression and the link with the physical activity and exercise. And just in terms of policy, you mentioned there about the Policy Evaluation Network. Does your group, can you see, for example, how this work can influence, policy at a national and international level?
Yeah, I mean, it can. And there's definitely, we think that people are starting, especially certain age groups, are starting to become more active as a result of government policy in terms of, you see the ads on TV, about exercise. And I think a lot of the TV shows at the moment are really, trying to remember the name of the big one, but they're really starting to, people are watching them thinking, I really should be exercising.
Operation Transformation.
Operation Transformation, yeah. That's the one, yeah. And I did a thing with Dr. Ava a while back, and there's a lot of kind of media like that. It's all very positive. And the government policy kind of drives that. And Ireland's the classic example of the benefits of government policy. And it's accidental because in the 1980s, they were looking for something to tax. And they decided to tax kind of sugar-sweetened drinks with no intention of being healthy. They just thought it was a nice thing to put a big tax on. And as a result, the consumption of it dropped markedly in Ireland in the 80s. And there's very good evidence of that. All the sales dropped. So it shows you that targeted policy, like taxing junk food, can actually make a difference to the health of a nation. And the same is true in exercise. And then targeted spend. One of my PhD students worked in schools, and there's no doubt that the kids in DESH schools, their physical activity levels are lower than kids in other schools. And if you're looking to target somewhere, then DESH schools, if you have a limited budget, there's maybe not such a problem of school inactivity, say in rural schools, but in DESH schools, there's definitely a problem. So if you wanted just with a limited budget to target kids that would benefit the most, spending on after school sport or whatever in DESH schools would definitely create a benefit. So that's why policy is really important. How you spend the money how you influence people is really important in driving these kind of long-term changes.
Yeah, fantastic. That's really fascinating. I must go back and look at that tax, that sugar tax, because very interestingly, a few nights ago, my son went off. He's only 13, so he went to the chipper, but he said he brought the same amount of money that he usually brings for his whatever he was getting a takeaway. And he said that there was 30 cents extra for the can of sugary drink that he was buying, which I thought was great. I thought this was fantastic that they're actually implementing, and they explained it to him as well, that it was a sugar tax, and just made him more thoughtful about what he was drinking.
Yeah, no, I think those types of interventions, and with Go Green routes will actually be, now we're not quite certain which route we're going to be working in Limerick, but it's possibly going to be the riverbank route. And what we'll try to do there is all the food outlets anywhere near it. So in Castletroy and as you go into town, we're going to work with them to develop healthy options and try and have them competitively priced. And there'll be an app, etc. And we're going to try and encourage people to select healthy options. So we'll encourage people who are using the green spaces to, if they're going to get a snack after, or etc., try and stream them towards picking healthy options out of existing kind of outlets. And even McDonald's has healthy options, you know, but it's encouraging people to take them up is the issue. And especially kids, as you say, very much driven by sugar, unfortunately.
Yeah. Absolutely. And just one last question. I'm sorry now. I realize if Patricia has a question, please come in on this discussion, Patricia. That tax that you mentioned, that sugar tax from the early 1980s, was that then lapsed? Was that allowed then?
Yeah, I think as various budgets came and went, it went away. And I imagine that the likes of, you know, Pepsi and Coca-Cola probably lobbied. But,
yeah, they're very strong lobbying groups in the food and drink industry, yeah.
But it is seen as a kind of classic example of it's called a natural experiment. They didn't set out to do an experiment, but actually they created an experiment. And it's a very good example of what you can do by differential taxation. So you put a tax on bad food and people go for better options. It's not so easy with physical activity, but then things like reductions for gym membership for people who need the gym more, shall we say. Those types of things, or maybe you get tax back if you're in a gym or you're doing some kind of activity. In the US, a lot of insurers that you have to pay to get your health care there, but a lot of insurers will actually allow you to share your phone activity data with them. And the more activity you do, the cheaper your rates are. And although we don't use that system here for most people, it's a great idea. You know, you actually get a discount on your health insurance if you're more active. So those types of nudges,
incentives, we'll say,
help people make those decisions are very important. You know, like cycling to work. You know, if employers put in showers, they put in, and maybe they encourage people, maybe they incentivize cycling in. If you don't use the car park at work, you actually get a slight pay rise. That kind of thing.
I'm all for that because I cycle to work every day, Ellen. So I'm all for that. I think you're absolutely right, though. And just leading on from that, sorry to hog the whole conversation, but just with regard to can those issues or the research focus or your research areas, that's so interesting about Go Green Routes, because I can see now a kind of synergy between climate action and exercise. And
yeah, there's very good evidence. Ty's not here and he's the expert, but there's very good evidence that exercise in green versus grey areas is much better for your health. One is the obvious one, that car exhausts. Unfortunately, we're diesel fiends in Ireland. There's a lot more diesel cars here than in other countries. But there's evidence that if you go for your jog down the Dublin Road or whatever, where it's very busy, you're inhaling a lot of stuff that's bad for you. Whereas if you exercise, say, down by the riverbank, trees and green areas are very important at soaking up pollutants. Yep. So your pollution levels are possibly a good bit lower. And then there's a mental health thing that we seem to benefit better from running in a green area than running in a grey area. There are lots of reasons why councils should be encouraged to, have routes through cities that are green, as opposed to just some dotted lines at the edge of a major road that's supposedly a cycleway.
Yeah. Excellent. Fascinating. Really brilliant. Mine, great. Thanks for your very informative. Yes, that was so fascinating, Alan. And I'm sorry to have taken up so much of your time with all my questions, but I just have so many, and you answer them with such patience and in such an informative way. That was really insightful, really fascinating to hear of the work that's going on. And thank you so much for your time, Alan, and really appreciate it.
And I hope the day goes well. Okay.
Yes, and you. Thanks, Alan.